Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them painlessly. Today's video features a quiz-style review to test your clinical understanding of vitamins. We've prepared case-based questions to connect theory with patient care examples. You'll find the correct answers listed in the pinned comment below. Let's begin. A 5-year-old girl presents with persistent leg pain for the past few weeks. Her mother reports she is a picky eater, mainly consuming foods like white bread and chicken nuggets. On exam, she appears pale, with swelling around her knees and small, red spots on her legs. Her gums are also bleeding, and her growth is below the 5th percentile for her age. Which connective tissue protein is most affected by a deficiency in the vitamin responsible for the patient's symptoms? Next, a full-term male neonate is born at home with assistance from their neighbor, who's a traditional birth attendant. The delivery was uncomplicated, and the mother reports no health issues during pregnancy. On day 4 of life, the baby develops a fever and seizures. His parents also notice bleeding around the umbilical stump. What is the most likely nutritional issue contributing to this presentation? Next, a 22-year-old first-time mother delivers a term infant with the condition shown in the image. Her pregnancy was otherwise uncomplicated, and her BMI was in the low normal range. Family history is unremarkable. Which vitamin, if supplemented early in pregnancy, could have helped prevent this outcome? Next, a 41-year-old woman consults at a Hollywood clinic for microneedling, a procedure that enhances skin texture and helps achieve a more youthful appearance. She takes a vitamin supplement, supposedly for youthful skin, recommended by her previous doctor before she migrated from South Korea a year ago. The physician assistant at the clinic advises her to stop taking the vitamin a few days before and after the procedure. Why is this precaution necessary? A. To reduce bleeding risk during healing. B. To speed up collagen formation post-treatment. C. To avoid skin photosensitivity. D. To ensure the procedure is painless. Next, a 13-year-old African-American boy with a BMI slightly low for his age presents with persistent back pain that began a week ago. He recalls jumping up and down at a New Year's Eve party when he suddenly felt sharp pain in his back. The pain has lingered since then, especially with movement. X-rays reveal a fracture at the T11-T12 level. Which of the following risk factors could have contributed to his back pain? A. Winter. B. Inadequate intake. C. The patient's skin type. D. A and B only. E. B and C only. F. All of the above. Next, a 21-year-old woman with a history of severe pimple breakouts over the past few years presents to the eye clinic with headaches, nausea, and blurry vision. She's had weight issues since her teenage years and began taking a pimple-fighting pill 2 months ago. After examining her, the ophthalmologist recommends a brain MRI, suspecting increased pressure inside the skull. Which vitamin, when taken in excess, produces the same effects as the drug she's taking? Next, an 80-year-old man presents with increasing fatigue, memory lapses, and occasional tingling in his feet. He lives alone and says he usually just has crackers, instant soup, and coffee most days, as preparing full meals feels like a chore. His daughter notes that he's been more forgetful and walks slower than usual. On examination, he appears pale and shows decreased vibration sensation in both legs. Lab tests are ordered. Which lab abnormality best matches this clinical picture? A. Small red blood cells. B. Low plasma calcium. C. Blood and crystals in urine. D. Large red blood cells. That's it for our vitamin quiz. If you want to check your answers, just head to the pinned comment below. We've listed everything down there for you. If you want to brush up on the details, you may revisit our vitamin video series. If you find this video helpful, don't forget to like, share, and subscribe. For more content like this, check out our next video. Thanks for watching.